that lack of flexibility.
Thank you.
Good morning, everyone, and I'm very, very tempted to explore more of the comments you made about behaviour policies and off-rolling and exclusion of SEND children. But I'm going to be disciplined for the first time ever. I'm going to be disciplined, though. However, I completely agree with you. I want to talk about the H bit in the EHCP plans to see whether you're getting the support or whether you feel like schools are getting the support in terms of the health provision, because I was reading a report from the NAHT which said that they thought that 83% of the people they asked said they didn't get any funding from health and social care budget. And of that 83% who said they didn't get any funding, 77% they'd never received anything even though it was needed. So I'd like to sort of really have a look into this. So do you think health and social care plan provide adequate funding and services for local authorities and schools for pupils with both SEN support and EHC plans, the health bit?
No. The worry is that the the funding system assumes a level playing field in relation to health contributions, and it absolutely isn't. There are huge differences between the level of willingness and ability to contribute. Health send people without the authority to make decisions on spending to meetings. It can be extremely difficult. I'm sure there are authorities where it does work, but I haven't personally experienced that. It is just extremely difficult, and I think you may hear from some of the head teachers later on. Head teachers do feel very vulnerable in this respect because staff are being asked to do medical care procedures for children that could involve an element of risk, and they feel that they're not being given the money to do it. Local authorities will quite often give the schools the money and then try and recover it from health, and that almost never is successful in my experience.
Matt?
I don't have a lot really to add other than anecdotes. So with deaf children, some of the difficulty is more around trying to get speech and language therapy established as an educational need rather than a health need, even though it's often the NHS that provides it. Legally, that's settled 20 years ago, that point. It's still an ongoing issue. The personal experience I've had, it's not been an issue because commissioning of services has been effective, but my own experience is fairly limited.
If you look at the Ofsted joint inspections of local authorities SEN, one of the things that comes out a lot in the statement letters is there isn't any joining up of services, that health and social care don't have a designated lead that education are aware of. And it's very unusual for someone from health and social care to come to an annual review of an AHC plan or an assessment of it. Sometimes it's actually difficult to get the local authority to turn up, actually. The school does it themselves, which is part of the problem. But so you don't get much health or social care input to EHC plans, which means you don't get the funding. I would be very surprised if a EHC plan that had a high level of health or social care funding, those weren't pre-existing commitments that the health and social care had already signed up to before the EHC plan was put in place.
Do you think then that schools and local authorities can provide the services and support children need without having this money and support from health and social care?
Most of the time, probably not.
I think it'd be very difficult and very risky. It's about meeting the basic needs of the child to enable them to access the education. And for some children in some of our special schools with very, very complex needs, that is the fundamental and the biggest part of their day. When you have children who can be fitting regularly, when you have children who stop breathing, the level of care they need is enormous, and you can't even start to try and help them make little steps until that's sorted.
So would you then therefore say, if you feel like the schools and local authorities can't overcome the problem of the lack of funding from health and social care, would you therefore say that our children are not getting the support they need because they're not getting the financial support from health and social care?
It's happening because the local authority and schools are working together to make sure it does happen, but it's just another pressure to add to the overall mix of what they've got. to handle.
I mean, again, anecdotally, I support that. One useful line of inquiry that hopefully will emerge soon will be the joint Special Educational Needs and Disability Tribunal pilot, which will cover health and social care. The first of the decisions from that pilot started in April, and by now there should be decisions coming out of that that may shed some light into the sort of individual issues you're mentioning.